Here we have MRI on 70-year-old with history of left-sided neck swelling. So what we see on this MRI is this large, well-defined, ovoid-shaped, heterogeneous, mixed-intensity mass situated in the left side of the neck. The most important thing is to localize the mass. This is probably the most important step in the neck imaging. What we see here is the carotid artery situated anterior to the mass, and as I come lower down you can see the internal carotid artery, and there is bifurcation of the internal carotid artery, and the external and internal carotid arteries are significantly displaced, and the tumor is sitting in between. Hence, the tumor is in the carotid space or posterior parapharyngeal space, as some people tell, but I would prefer the term carotid space, which differentiate it from a parapharyngeal space. Once we localize the tumor in the right or correct neck space, then half of our problem is solved, because the list of differential diagnoses will significantly reduced. After that, we characterize the lesion. The lesion shows heterogeneous iso-intense signal intensity on T1, heterogeneous mixed signal intensity on fat-sat T2 sequence, and following gadolinium there is intense heterogeneous enhancement. So the tumor is situated in the carotid space. There is playing of the external and internal carotid arteries, and the tumor has got mixed appearance with intense enhancement. Putting all these findings, the tumor is most likely to represent a carotid sheath tumor or a paraganglioma. I would not like to give any other differential at this time, and I would uh, discuss with the ENT team to further review and discuss regarding the best course of diagnosis and treatment in the multidisciplinary team meeting. So, in summary, we have got a case of left carotid body tumor. Pathologically, it is paraganglioma.